Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Achalasia, esophageal achalasia. Introduction. Achalasia is a relatively rare disorder of the smooth muscle of the esophagus. The esophagus is a muscular tube that carries food and liquids from the mouth to the stomach. Achalasia makes it difficult for food and liquid to pass into the stomach from the esophagus. Ayurvedic view. In Ayurveda, this condition is termed as Nigalanikastata. It is Vata disorder. Ayurvedic treatment can relieve the symptoms and improve quality of life. Causes. At the bottom of the esophagus where it meets the stomach is a muscle called the lower esophageal sphincter, LES. When not swallowing, the lower esophageal sphincter remains closed to keep food, liquid, and stomach acid from moving back into the esophageal tube. When swallowing, nerve signals tell muscles to contract to push food down the esophagus, an action called peristalsis, and allow the lower esophageal sphincter to open. In people with achalasia, the nerve cells in the lower esophageal tube and the lower esophageal sphincter do not work correctly. This results in uncoordinated peristaltic, muscular, activity, failure of the lower esophageal sphincter to open completely. While achalasia is associated with the loss of nerve cells in the esophagus, the cause of this process is unknown. Risk factors. A risk factor is something that increases your chances of getting a disease or condition. Because the exact cause of achalasia is unknown, risk factors are unknown. Symptoms. Symptoms of achalasia can occur between the ages of 25 and 60. Symptoms rarely develop on children. Symptoms tend to be mild at first, and then grow worse over months or years. The main symptom is difficulty swallowing solids and, as the disorder progresses, liquids. As many as 70 to 97% of patients with achalasia have difficulty swallowing both solids and liquids. Other symptoms may include discomfort or pain in the chest, under the breastbone, especially after meals, coughing, especially when lying down, heartburn, weight loss, as the disorder progresses, vomiting or regurgitating food or liquids. In some people this occurs during sleep. This can result in inhalation of food particles or liquid, which can lead to aspiration pneumonia and other respiratory infections. Diagnosis. You will be asked about your symptoms and medical history. A physical exam will be done. Your nadi or pulse is examined to assess your body type and disease status. Medical tests may include manometry. A tube is inserted down the throat to test the pressure in the esophagus and the stomach when swallowing. Esophagram. X-rays are taken of the esophagus while you swallow barium, a thick liquid that lights up on X-rays. Upper gastrointestinal endoscopy, esophagoscopy. The esophagus is viewed directly through a fiber optic tube to look for other causes of the symptoms. Prevention strategies. There are certain tips for coping achalasia. 1. Eat smaller meals more frequently. 2. Eat slowly and chew well. 3. Don't eat too late. 4. Beware of eating when feeling stressed. 5. Eat fairly moist food. 6. Lifting the chest and taking a deep breath also helps. 7. Keep a small bottle of water handy in case one's esophageal muscles go into spasm when out and about. 8. Don't have drinks too cold. 9. Eat early in the evening. 10. Don't drink before bedtime. 11. Don't eat too many nibbles such as crisps and nuts or drink too many glasses of wine before a meal in the evening. 12. A good start to the day is a fruit smoothie using a wide variety of fruit liquidized with a live yogurt and a good teaspoon of honey. 13. Take some multigrain toast with hot water. 14. Always have a drink with the meals. Gulps between every few mouthfuls help. 15. Most important factor in managing your eating is drinking hot water. Temperature is important, half cold and half boiling. The technique involves judging how much food you can eat before you have to gulp down some water. 16. Soups are a good way of eating a variety of nutrients as they can be liquidized. Include all vegetables in pulses and experiment to get something you really like, sometimes topped with butter or cheese. 17. Avoid eating skins on fruit and veg, but do churn them up in smoothies and soups. 18. Avoid fatty meat and eat mostly chicken, fish or vegetarian dishes. You can even manage pizza if I drink enough hot water with it. 19. Also avoid spicy food, and drinking alcohol with food is very difficult. 20. Salads are best eaten with lots of dressing and in small quantities. 21. Be aware of the types of food you personally need to avoid, and what can be digested easily. 22. Avoid the following. A. Large lumps of meat. B. Dry chicken can be a problem. C. Pasta of any sort. D. Too much bread. You can eat crackers better than bread. E. Potatoes can be a problem if boiled, but thin French fries are not too bad. F. Rice. Fried rice is better than fluffy stuff. 23. Basically, it seems it is the consistency of the food which has more influence than anything. 24. Don't eat too much bread in one sitting, and eat good quality bread rather than soft white bread, which is particularly bad for blocking the esophagus. 25. Avoid very dry food like raw cauliflower, raw carrot. 26. Sleep propped up with lots of pillows to help stop food and drink coming back up at night. 27. A bed wedge is a useful alternative to lots of pillows to keep you propped up at night. 28. Finish the day with a good teaspoon of honey and lemon juice in hot water. 29. Relaxation helps to avoid spasms and pain with the sphincter. 30. Yoga helps, as does drinking hot water to relieve the pain. 31. Pain from the sphincter can be avoided by warming up cold food and drink in the mouth first before allowing it to go down. Avoid letting the chest get cold. Cold wind can set up pain. Wear a scarf even if you don't feel cold. Ayurvedic treatment. The goal of treatment is to make it easier for the LES to open. Treatment may include 1. Vadahara drugs. 2. Urovasthi, hot oil on chest. 3. Sudhakarma, fermentation on chest. 4. Panchakarma, purification therapies. 5. Drugless therapies like meditation. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.